A government big enough to give you everything you want is a government big enough to take away everything that you have. According to a recent issue brief by Robin Rudowitz, Patrick Drake, Jennifer Tolbert, and Anthony D'Amico, an estimated 1.9 million individuals fall into the coverage gap in the 10 states that have not adopted the Affordable Care Act's ACA, Medicaid expansion as of March 2023. These individuals have incomes above their state's eligibility for Medicaid but below poverty, making them ineligible for subsidies in the ACA marketplaces. If all states adopted the Medicaid expansion, many of these uninsured individuals would be eligible for Medicaid coverage. In states that have not expanded their programs, Medicaid eligibility for adults is very low, with the median income limit for parents at just 38% FPL. Nearly all non-expansion states have not expanded Medicaid to childless adults regardless of their income, except Wisconsin through a waiver. States that have not implemented the expansion have uninsured rates that are nearly double the rate of expansion states. The characteristics of people in the coverage gap show that adults left in the coverage gap are concentrated in 3 states in the South, with Texas having the largest number of uninsured individuals. The test of our progress is not whether we add more to the abundance of those who have much, it is whether we provide enough for those who have too little. There are various options that can be considered for people who fall out of the Medicaid policy but cannot afford health insurance. These options include looking for other health insurance options such as subsidized plans through the Affordable Care Act, ACA, marketplace, moving to a state that has expanded Medicaid, seeking special enrollment periods for ACA plans, seeking assistance from various organizations, and finding local resources with the help of healthcare providers or social workers. And as for the government, they can take steps to help those who fall out of the Medicaid policy and cannot afford health insurance. One possible solution is for the government to expand Medicaid coverage to include all individuals below a certain income threshold, regardless of whether or not they meet other eligibility requirements. Additionally, the government could provide more funding for programs that help low-income individuals afford health care, such as community health centers and free clinics. Finally, the government could consider implementing policies that help to control the cost of health care, such as regulating drug prices or increasing competition among insurers. We are all interconnected, and what we do today will impact others tomorrow. Without proper access to affordable healthcare, individuals who fall out of the Medicaid policy and cannot afford health insurance may delay seeking medical attention, leading to more serious health problems down the road. They may also experience financial hardship as a result of medical bills and debt. In the worst-case scenario, they may forego necessary medical care altogether, putting their health and lives at risk. The lack of access to healthcare for individuals who fall out of the Medicaid policy and cannot afford it can have a significant impact on society as a whole. Firstly, it can lead to higher healthcare costs in the long run. When people don't have access to affordable healthcare, they are less likely to seek medical care when needed. As a result, their conditions may worsen, leading to more serious health problems that require more expensive medical treatments. This can increase overall healthcare costs for society. Secondly, it can lead to decreased productivity and increased absenteeism. If people are not able to receive medical care when they need it, they may be forced to miss work or school to attend to their health needs. This can lead to decreased productivity and lower economic growth. Finally, it can lead to increased health disparities. People who cannot afford healthcare may have limited access to preventative care and early intervention services, leading to poorer health outcomes. This can exacerbate existing health disparities and further widen the gap between the haves and have-nots.